Thank you, everyone, for joining us this evening for a highly anticipated talk on medical marijuana and cannabidiol. We are joined by Dr. Joseph Maroon and Jeff Bose, PhD. Dr. Joseph Maroon is a clinical professor and vice chairman of the Department of Neurosurgery and the Heindel Scholar in Neuroscience at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. In 1990, he co-developed the IMPACT neurocognitive test, which is the only FDA-approved test for concussion assessment and is the standard of care in most amateur and professional sports organizations. He is the senior vice president of the American Academy of Anti-Aging Medicine. He has been the team neurosurgeon for the Pittsburgh Steelers for 30 years. He has published over 270 peer-reviewed papers, 54 book chapters, and 5 books. He has written and lectured extensively on the use of nutrition, exercise, and life balance to improve longevity and to prevent disease. Jeff Bose, PhD, is a clinical instructor in the Department of Neurosurgery at the University of Pittsburgh Medical Center and clinical assistant professor at Chatham University. He has a special interest in minimally invasive spine and brain surgery and has collaborated on scores of scientific medical papers and books in these areas. Over the last 15 years, he has researched, lectured, and written on the use of alternative treatments for pain control. Mr. Bose, along with Dr. Joseph Maroon, have authored 2 books on the use of omega-3 fish oil, including Fish Oil, the Natural Anti-Inflammatory, currently on its 4th printing with over 75,000 copies sold, and recently, Why You Need Fish Oil. He has given over 100 invited lectures, 24 national posters and oral presentations, 29 coordinated research papers, 5 workshop presentations, 35 scientific articles, and 10 book chapters. We're so excited to have you both with us tonight. We do have a full house, and we will do our best to address as many questions as possible at the end of the webinar. Please type your questions into the chat box as they come up. So now with that, Dr. Maroon, I will turn the webinar over to you.
Thank you very much, Giselle, and I personally want to thank all of you for tuning in tonight. We have over 1,000 participants, and we're dealing with a subject that I think many have many questions about. I continue to learn every day what all healthcare providers need to know about medical marijuana and cannabidiol. As a practicing neurosurgeon dealing with a tremendous number of patients with pain problems, discogenic disease, cervical spondylosis, traumatic injuries of all kind. And with the opioid epidemic in the United States now killing 63,000 plus people a year. So what alternatives are there that we might explore in terms of pain relief, anti-inflammatories, anxiolytic properties? And when we think of these things, clearly we all need to understand better more about medical marijuana, THC, and cannabidiol. So I also want to announce your welcoming to the A4M meeting to be held April 13th and 14th in Hollywood, Florida. The subject of the theme of the meeting this year is awakening, and it really is focused on brain health. And the keynote presenters include Daniel Amen, a renowned best-selling author on how to really improve your brain, Rudolph Tanzi, a vice chair of neurology at the Mass General, and co-discovery of 3 of the first Alzheimer's disease genes, Brennan Spiegel, from Cedars-Sinai, Ron Kaufman, an authority on autism, and many, many more. So it will prove to be a very exciting conference with internationally recognized presenters. So what we're going to do tonight is move on. And this is one of the pre-conferences that Jeff Bose and I are going to be hosting on April the 12th. And it will feature a detailed discussion of the endocannabinoid system, these agents relative to neurological applications, MS and others, and head trauma, cancer, pain, and some of the psychological benefits, the inflammatory metabolic disorders, and then also get into the legal, regulatory, dosing, and safety aspects. All of this will be a pre-conference workshop that certainly all are invited to attend. Tonight, we're going to spend 30, 40 minutes or so with you talking about a wide variety of kind of an overview of the phytocannabinoids and other extracts from the plants, the various health-related applications of medical marijuana, and also the latest clinical research dealing with cancer, cancer prevention, neurological disorders, and also training to include specific dosing, side effects, which we will discuss to some extent. So these are the objectives that we hope to accomplish at the workshop. And so let's get on with it. So tonight, applications. The endocannabinoid overview, discovery, mechanism of action, and the endo versus the phytocannabinoids. And no discussion of marijuana or CBD can begin, I think, without addressing the father of marijuana, the father and discoverer of the endocannabinoid system, Raphael Mikulan, who was born in Bulgaria, escaped to Israel in 1949, attended the Weizmann Institute, and when he finished his graduate PhD in medicinal chemistry, was looking for topics to investigate and study. And he knew that for many, many years that morphine was derived from the opium plant, cocaine from the cocoa leaf, but the chemistry of the marijuana plant was really not pursued much at all. In fact, very little was known about why marijuana has been used by witch doctors, shamans, physicians, and practitioners back into ancient China in the 2,500, 3,000 years ago. You know, what were the compounds in the marijuana plant that led to the really looking for medicinal or psychoactive components? So in pursuit of this, he proceeded to analyze the marijuana plant and its various compounds, and discovered that THC was the primary active ingredient in the plant that led to its psychoactive effects and also any therapeutic effects as well. And that was about 1964, in the early 60s. In 1990, he discovered a compound called anandamide, which is the body's own marijuana, if you would. It's a derived, anandamide comes from the Sanskrit word meaning bliss or blissful. And it's like dopamine and other agents that we make endogenously that give us a high or a good feeling. In fact, for many, many years, I thought the runner's high was primarily due to dopamine and enkephalins. We now know that it really is stimulation of the cannabinoid system that we'll discuss in much more detail that contributes in a very significant way to the flow experience that we get from so many different kinds of activities. So that proceeding from that, we'll talk a little bit about cancer and also the analgesic effect and some of the neurological disorders that it has been used for, and also the very potent effect on inflammation, pain, and various metabolic disorders, and how it may have some application in severe traumatic brain injury. So the endocannabinoid system, we've grown up as physicians and practitioners knowing about the digestive system, the regulatory system, the cardiovascular system, the respiratory system, but really relatively few physicians that I speak to are really aware of the endocannabinoid system. And some people have described it as really the discovery of somewhat of a sixth sense, a very profound discovery, because the endocannabinoid system is a primary regulator of homeostasis in our body. And it affects virtually all organs. And it's thought to be the largest receptor system in our bodies. There are no diseases that aren't in some way related to the endocannabinoid system. And I mentioned anandamide and 2-AG, which are endogenous endocannabinoid substances. In other words, these are substances that we make every day, our own, if you would, medical endogenous marijuana. So what is the endocannabinoid system? And what was discovered also by Raphael McCoolin, not only the chemicals, but also the receptors. And it was the discovery of the CB1 receptor that THC locked into, and subsequently the CB2 receptors that primarily interact with cannabidiol, CBD, that it was recognized only in the 90s that the prolific nature of the endocannabinoid system and its incredible, powerful effect on virtually everything we do in terms of pain modulation, memory, appetite, anti-inflammation, and powerfully in our immune system. The receptors in our tonsils, our thymus, our spleen are incredibly important in terms of cytokine formation, of immunity cells, our T cells, our killer cells, and the importance of this system in terms of our immunity cannot be overestimated. So we mentioned the CB receptors that are primarily located centrally, but also to some extent in the peripheral nervous system. They're distributed throughout the brain. They account for a big input into pleasure, into memory, how we process information, our thought processes, our cognitive awareness, our ability to concentrate, sensory and time perceptions, coordinated movements. And these are all primarily affected and with THC. So THC, simplistically stated, binds primarily to the CB1 receptors. And at the bottom of the slide, you can see that these CB1 receptors are sparsely found in the cardiopulmonary centers of the brainstem. So what's the significance of that? Well, you might ask yourself, we know that the epidemic of opioid deaths primarily results from suppression of the respiratory system, so that the opioids are powerfully affecting our sleep-wake systems, the reticular activating system, and the respiratory system in our brainstem. In contrast, THC rarely is associated with an overdose or with death. And it's primarily because of the lack of receptors in the cardiopulmonary centers of the brainstem. The CB2 receptors, on the other hand, I mentioned, are located primarily in the immune system, the immune cells, the thymus, the spleen, and also in the peripheral nervous system. So when activated, they can act as analgesics, anti-inflammatories, and also modulate the immune system. It controls the release of cytokines and also various cell migration. And this is the cannabidiol, CBD, that affect primarily the CB2 receptors. Also to be added is that cannabidiol does not have the psychotropic effects as THC, so that you don't get high on CBD and also you don't get the memory impairment, the impairment of concentration and thought, and also it doesn't affect the appetite, so the so-called munchies that some people describe and experience with THC. So when we talk about plant-based medical marijuana, there are now 29 states plus Washington, D.C. and Puerto Rico that have approved by prescription for medical purposes medical marijuana. Now, it still is not approved by the FDA. It's still considered a Class 1 drug. Hopefully, this will be approached in a more sane way. However, the indications for medical marijuana use, the state of Pennsylvania just passed a law legalizing medical marijuana, include the illnesses or the conditions that you see listed: intractable headaches, cancer pain, nerve pain, neuropathy, muscle spasms and spasticity, glaucoma, the nausea often induced by cancer chemotherapy, and also to enhance appetite in case of weight loss by chronic illnesses such as HIV. There are studies coming out frequently about Crohn's disease, and also PTSD, post-traumatic shock disorder, which affects a very high percentage of our soldiers coming back from the Middle East. 15 to 20% of patients, or those who serve in those theaters, have some psychological effects that often require very powerful medications. This is a consideration. And then intractable seizures. The recent studies by GW Pharmaceuticals in London, having approval actually for Lennox-Gastaut syndrome, for pediatric epilepsy, are all very, very significant applications. It's also important to realize that there are over 60 phytocannabinoids found in marijuana and hemp, with a large variety of actions. A few years back, we wrote a book entitled The Longevity Factor, how resveratrol activates genes for a longer life. And I was amazed when we were doing the research on that in a glass of red wine, besides resveratrol, the active antioxidant, there are up to 400 additional polyphenols that have, to some variable degree, some kind of effect, in a entourage effect, with all of them acting together, as the term is used. So when we look at CBD, we notice, and I mentioned above, marijuana and hemp. CBD is now primarily derived from the hemp plant. Now, both of these are from the Cannabis sativa genus, but marijuana from the marijuana plant and hemp from the hemp plant gives rise to cannabidiol, or CBD. And you can read the various therapeutic benefits that have been well documented in terms of CBD. As an antibacterial, it inhibits cancer cell growth, and actually it was patented as a neuroprotective by the scientists at the NIH. It promotes bone growth in terms of osteoblastic activity, reduces seizures. You may recall the 3-part series about 2.5 to 3 years ago by Sanjay Gupta on weed that was featured on CNN. And actually, what he really featured was the use of cannabidiol in the treatment of of epilepsy, childhood epilepsy, in a family who had a child having 100 to 200 seizures a day. And cannabidiol was the really primarily effective agent that markedly reduced the seizures. And it was much more than just about marijuana. He featured the product from Charlotte's Web, CBD or cannabidiol. And as we mentioned, it reduces function in the immune system in terms of reducing the inflammatory agents. We know that cancer, heart disease, arthritis, MS, Alzheimer's disease, all have major components of inflammation. So by controlling inflammation, either with our diet and with exercise and other epigenetic factors, reducing stress, all of these reduce the incidence of these other diseases. And primarily as an analgesic, CBD has been catching on, if you would, in a much bigger way because of its lack or absence of psychotropic effect. There can be an analgesic effect without the psychotropic effect. And also, I'll discuss in a few minutes some of the patients that I've had in terms of its anxiolytic effect or relieving anxiety, and also being more conducive to sleep. So how does CBD work in the human body? We've mentioned some of these. It relieves anxiety, and it's neuroprotective. And we mentioned the analgesic effect, some suggestions that it reduces atherosclerosis to some extent, probably the anti-inflammatory component, and it may promote bone growth. So just a couple quick anecdotal, and I emphasize anecdotal reports. This is the history of a 16-year-old young lady who in high school was hit in the head by a soccer ball, had a concussion, and subsequently developed prolonged headaches, anxiety, poor concentration, and was actually diagnosed as having a post-concussion syndrome, was placed on Ativan and other psychotropic agents, had significant lethargy, sleep problems, and subsequently this did improve somewhat spontaneously. But then at age 17, playing lacrosse, had another concussion and the same symptoms. Her grades dropped off substantially, literally had to stop all sports, was placed on trazodone after a few other psychotropic agents failed, and then was actually made worse when she was hit by a locker door in school and exacerbated her concussions. So we did a very thorough evaluation, normal MRI, normal CAT scan. Her impact test was significantly impaired and in terms of concentration. And we did two things, actually. I referred her for hyperbaric oxygen therapy and also recommended CBD. And the CBD was relatively low dose, 15 milligram tablets and an oral spray that she used 3 times a day. And subsequently, in just this past year, she wrote to me, I've been taking it for 3 weeks, but recently, in speaking with her, she's just finishing up her studies at Penn State University, and is getting 4.0 in bioengineering and going into medical school. And the things that she noticed most impressively was it helped with sleep and also anxiety. These two factors made her less fatigued, able to concentrate, and now functioning at a very high level. after 3 years of on and off struggling with significant post-concussion syndrome. Another case, a physician assistant who works for a local orthopedic doctor here in the city. I gave a talk on this at the Pennsylvania Orthopedic Society Association last year, and talked about the potential therapeutic benefits of CBD. And she came up afterwards and said, I've been taking Botox treatments for a couple of years, but insurance guidelines and this, I hate to take it. And might I try this? And so she also was taking ibuprofen as needed, which was giving her an ulcer. So we did that. We put her on CBD, the same dose. And she wanted to give me an update. Although early, she's had only 2 migraines, and she was having migraines several times per week. And even more recently, she contacted me, and it's had a major effect on her migraines. And when I asked again specifically, it was the anti-anxiety effect and the ability to help her sleep. And subsequently, particularly in my own experience with women or girls, ladies who have had post-concussion syndrome, I've found that, again, it's a benign therapy and seems to have a significant effect on anxiety, sleep, and also reduces stress and able to focus better on their work. And another post-concussion syndrome, a TV reporter, chronic headaches and anxiety. And she feels that it made a huge difference for her after really a couple of years of struggling. So again, very anecdotal. We are actually doing a study here in Pittsburgh. We're working with a group of chiropractors who have been using CBD fairly liberally in their practice for pain and also various anxiety disorders, hoping to do a prospective study to look at this in a more in-depth and more scientific way. But we have a huge concussion clinic here at the University of Pittsburgh, literally seeing 10,000 new patients a year with post-concussion syndrome. And the great majority of these clear on their own, spontaneously, but not infrequently. Patients will come in with their parents on a list of 4 or 5 different psychotropic agents. And it's really disheartening and disconcerting to see the drugs that are used that have very major side effects, when I think we need to explore this side of cannabidiol in particular in a more diligent way. So in terms of the health benefits of THC, we know that it can be used beneficially in terms of increased appetite and weight gain, which also can be a downside for those who use it too liberally. And there are quite a few studies now coming out about the use of this, possibly because of its apoptotic effect in growing tumors, a possible benefit for patients with malignancies. And also, it clearly can help with nausea, spasticity in MS. That's one of the features that it has been used for, spasticity, not necessarily pain, but for spasticity, according to the American Neurological Society. And the safety concerns are, you have to be aware, of course, of the psychoactive effects. There is limited data on dosing, and we clearly need more human studies, long-term studies. With the benefits of CBD, again, I emphasize the non-psychoactive component of it, the anti-inflammatory, the neuroprotection, and the analgesic, anxiolytic, and clearly for kids with juvenile seizure disorder, the anti-seizure component of this is gaining stature scientifically as we speak. And also, there are papers now indicating in terms of neurotrauma that it could be very beneficial, again, in terms of its neuroprotective, antioxidant effects. So with that, we've gone through a lot of information, and we'll be happy to attempt to answer your questions.
Yes, I see a few questions, well, a bunch of questions that came up. So the first one is, typically I see CBD oil products indicating trace amounts of THC. Are these hemp products, i.e. does hemp contain trace amounts of THC?
Are they
hemp products?
Yes, there are hemp products, but that introduces a very important, another important question. That they're virtually all of them are derived from hemp. And by law, they have to have less than 0.3% THC. However, what I'm asked frequently, well, will I test positive for THC if I'm using this? The chances are very small that they will, but this is a very important issue for athletes. And unfortunately, or for however your leaning is, it's still THC under any amount is prohibited in various competitive athletics. I would add that WADA, the World Anti-Doping Association, as of January 1st of this year, just legalized CBD for Olympic competition. The problem is with the sensitivity of the tests for THC. If you're using an extremely sensitive test, there may be a positive test for it. You may test positive with that. So in terms of jobs, etc. Now, there are purveyors, manufacturers that will or do have pure CBD now without any THC. So if it becomes an issue relative to athletics or your job, I think you still have to be careful.
Right. Okay, the next question. What about cannabinoid receptors in the GI tract? What is the mechanism of action in Crohn's disease?
An excellent question. So Crohn's disease is the ultimate in inflammation of the body. I mean, it's a rampant, horrid inflammatory process in the GI tract, so that the application or the postulated mechanism would be the anti-inflammatory action through the immune system in terms of reducing the cytokines, the chemokines, the proteases that get released during the inflammatory process that lead to the ulcerations and the subsequent horrible complications with it. So the mechanism would be anti-inflammatory and suppressing the immune response.
Mm-hmm. Okay. And do different symptoms require different doses of CBD? This is a more generalized question.
And again, an excellent question. And it brings up the problem is we don't know what the best doses are for each particular condition. And in my practice, I suggest starting with 15 to 25 milligrams for a few days, and then increasing that to 30 to 50 milligrams and possibly up to 100 milligrams. You can take up to 1,500 milligrams with absolutely no significant side effects. But there's also an inverse relationship in dosing, in the sense that larger amounts are not always better with CBD. So you want to start with the low dose and increase over the course of a couple of week or two.
And Dr. Maroon, I'd like to comment that our panel is going to give a lot of their own information on their practice of using medical marijuana at the workshop. So a lot of uses that they found helpful will be reviewed at the workshops as well.
Very good. We still have time for a few more questions. So another one is, chronic kidney disease is considered chronic in its inflammatory state. Is there any research on benefits of CBD and or THC in controlling its progression?
That is a question that I don't know the answer to that. I don't recall seeing much at all in terms of the use of THC or CBD in chronic renal disease. I'm just not aware of much on that subject at all. Sorry.
Okay. Here's one about topicals. It says CBD elixirs and topicals have different carrier oils. Can you discuss the differences between olive, coconut, emu, etc., with regard to the bioavailability of the CBD?
The bioavailability in various, well, I know there are various products. In fact, I just saw an article today in the Pittsburgh Post-Gazette, our newspaper, a whole section on the use of CBD for cosmetic purposes as an anti-wrinkle agent. We know it can be used for acne in terms of the anti-inflammatory action on the skin glands that secrete the sebum. In terms of the carrier mechanisms, in terms of penetration and absorbability, I'm not very familiar with that. In terms of like the pharmacokinetics, how much gets absorbed when you put it on the skin, I'm not aware again of studies on that, although there may be.
Okay. And one more. Would the immune modulation effect of LDN be enhanced with CBD given concomitantly at bedtime as well?
What was the disease state?
If it was, would the immune modulation effect of LDN be enhanced?
LDM.
Okay. I'll ask for clarification. There's nothing further in the question. I can go for another one.
I just like to comment. The idea of modulation is really what CBD is about. Going back to the Crohn's question, I mean, if something's inflamed, the CBD is going to affect that. So the idea that it's trying to, as Dr. Maroon said at the very beginning of the lecture, it's about homeostasis, the idea of balancing. And I think that's one of the things how ubiquitous CBD can work is the fact that it works throughout the body to try to maintain a homeostasis. So if the immune function in this question is out of line, I think that's one of the things that CBD does is bring things back into order.
Okay. And last question, do you find THC to be a positive treatment for cognitive deficiencies and mental disorders?
Do we find THC to be a therapeutic benefit in cognitive disorders? There are studies that suggest that THC actually prevents or reduces the amount of beta amyloid plaque in brain. And as you know, beta amyloid plaque and also neurofibrillary tangles are the hallmarks of Alzheimer's disease and neurodegenerative disease. So, and I can't speak to my personal experience in terms of enhancing cognitive benefits. In the older population, I've seen studies that it does. Clearly, in the young population, particularly teenagers, I think THC can be very deleterious and dangerous to brain function with the pruning and the synaptic connections and the axonal pathways still developing. THC, I think, can be very deleterious. I think there was a recent article in the JAMA on women who smoke THC during pregnancy. It can have a definite effect on the endocannabinoid system that begins to form actually by gestation day 16 to 20. So when if a woman is smoking weed during early pregnancy, you really don't know, but it is possible to have deleterious effects on the developing endocannabinoid system. Well, we appreciate all of your participation and look forward to seeing you in Hollywood, Florida, April 12th, the 13th, and 14th. Thank you, Giselle.
Thank you, Dr. Maroon. Thank you, everyone, for joining us. And with that, we'd like to wish you all a great evening and also mention that we are extending a $100 savings if you register to attend the Cannabis and Medicine workshop in Hollywood. Please give us a call at our office at 561-997-0112 and speak to one of our educational advisors about registering for the conference. Thank you again and good evening.